Hey, what's up guys, my name is Jin and I'm a physical therapist. In today's video we're going to talk about blood flow restriction training or BFR training and what this method of training or rehab is. We use this in my clinic as well for some athletes or some patients, and it's become more relevant over the last couple of years because of how beneficial this has been in the rehab world. And so let's dive deep into what this is and how it may be useful for you. Blood flow restriction training, BFR training, it aims to reduce oxygen delivery to the muscle cells. So it gives the muscle less oxygen, less nutrition to work with. And so that creates a hypoxic and ischemic condition, meaning there's less oxygen for the muscle. So if you're giving the muscle less to work with, it has to work harder. And by working harder, it stimulates muscle hypertrophy. It tends to grow in size, and so it gets stronger as well. By initiating cell signaling and hormonal changes that stimulates protein synthesis, BFR aims to create that kind of environment for the muscle. And so there's physiologic benefits to BFR training, as well as benefiting hypertrophy and speeding up that process. So these are some of the pictures that shows how BFR is used. There's that cuff around the leg. If you look at the very first picture on the left, you want that cuff to be at the most proximal place, so as close to your hip as possible. And then what the machine does is it measures the appropriate blood pressure that you want to be set in, and then from there it works like a blood pressure cuff. Essentially it squeezes, and that's how it creates the hypoxic environment for the muscle. And then from there you participate in different exercises and activities, like the next picture here, doing a squat, right? Or you can also use it for upper body exercises, so having it at the most proximal spot as well. This one is a little bit lower, but same thing, blood pressure cuff. It squeezes, right? Cuts off that venous return to the heart, and then that's how it creates that environment for the muscle to work in. And so you can do a biceps curl there, you can do very different things, but the whole idea is to do lighter load activities for more reps. And so let's dive deep into what kind of patients or athletes can benefit from BFR training. So athletes during an active recovery week can definitely benefit from it. You don't want to give your clients or athletes heavy load or high intensity workouts every time. So active recovery week has been shown to benefit some athletes more than just giving them a break day sometimes. And so with the BFR, you can participate still in low intensity, low load exercises even when you're on recovery week. And so that can be beneficial. And then for patients undergoing surgery with weight-bearing restrictions, so things like ankle fracture fixation surgery, where they give you a stabilizing hardware in the ankle, or a bunion removal surgery where they have weight-bearing restrictions for you right after the surgery, and hip replacement surgery, things like this. You're not able to bear weight or put weight on your feet after the surgery. So a good way to minimize muscle atrophy while you're on the acute side of things in terms of rehab. And then it's also beneficial for elderly population with recent illness and generalized weakness. If I'm working with a patient who had COVID or a recent illness that tends to be weaker, on the weaker side, so it's harder for them to do things like squats, or even harder for them to walk, right? If I'm treating them in my clinic and I still want to work on their quad strength, I could potentially use blood flow restriction training to still continue working on the quad strength and minimize muscle atrophy, because muscle atrophies happen fast. So it allows for the prevention of the muscular loss. That's what muscle atrophy is. So I'm going to go over some example training protocols here. There's 2 that I wanted to go over just so you guys can get an idea of how this is used in a clinical setting. This first one, you can do squats and leg curls, right? So those are the 2 exercises. Same squat, same leg curl, but now you're doing it for 3 sets of 15 at 20% 1 rep max. So like I said, light load, and then high rep, right? And then for this study specifically, they tried it for 8 days for 2 sessions a day. And then cuff location and pressure is, like we talked about in the first slide, it's the proximal thigh, higher in your thigh, and then you increase the pressure to 160 and 240, and then that's the pressure that you were working with. If you use a blood pressure cuff that's automatic, so you don't do it manually, it measures the LOP for you, and so it's easier. But I guess in this study they didn't have that, or they just set it at 160 to 240. So after participating in these exercises, they have seen significant improvements versus the control group that didn't use blood flow restriction training in 1 rep max leg press. So how much they can leg press in 1 rep. 30 meter and 10 meter sprint time also improved. And then muscle bone cross-sectional area, so hypertrophy, and thigh muscle thickness also improved as well. Here's another training protocol that I wanted to go over. In this one, there's 2 ways to do it for muscle strength. They used a lower load, so 30% of 1 rep max. And then for resisting muscle atrophy, like we talked about earlier, if you want to minimize atrophy, they just use body weight with minimal to no resistance at all. So in order to build strength for our athletes here, you would want to still put some load on that limb, if it's a leg, if it's an arm. In this study, they used 30% of 1 rep max. And then if you're just trying to resist atrophy, body weight or no resistance is fine. Here's what I was talking about earlier with the pressure. You want to go at 80% of limb occlusion pressure. This is calculated by the machine, so you don't have to do it manually. And then the rest period, you want to set it at 15 to 30 seconds with the cuff inflated in between your sets. And then you want to try to do 4 sets of 30 reps, 15 reps, 15 reps, and 15 reps. So doing 30, 15, 15, 15, taking a break, doing that again, and doing that 4 times. For progression, if you're aiming to build strength, you want to discontinue when transitioning into power movement. So if you want to incorporate speed and force development in a shortest amount of time, that's when you want to move away from BFR and then focus more on power training. If it's for resisting muscle atrophy, you can start with some weight bearing exercises from open chain exercises. And so that's a good progression or a transition if you're looking to advance your BFR training. And then location, like we talked about, it's the most proximal portion of the limb, whether that's your arm or your leg. So that's all for today. I hope you guys enjoy that video. It's a very interesting and exciting time for BFR. If you have any questions, you can leave it in the comment section down below, and I will see you guys next time. Thank you for watching.